Dr. Yesh Navalgund is one of the country's most respected authorities on interventional pain management. The founder and owner of a large independent pain practice in Pittsburgh, Pennsylvania. He serves as president of the Pennsylvania Pain Society and as a faculty member at the Rockefeller Neuroscience Institute. We recently spoke with him about neuroplasticity.
So neuroplasticity is a phenomenon that is seen in humans, particularly when learning takes place or changes in behavior. And what it is it's the rewiring of the nervous system, particularly in the brain. What we find in these patients is that when we force them to make conscious changes in behavior and patterns, they start to become the norm. Examples in everyday life that we see neuroplasticity occurring are learning a second language, for instance. Getting started is very difficult because we're pre-wired in a certain way to think a certain way and speak a certain way. But after some time spent looking at a new language, learning a few words, using it in practice, it starts to get easier and easier, and the next thing you know, you're able to speak a second language. So when you learn a second language, you literally have rewired your brain and you didn't realize that neuroplasticity was taking place. Other examples of neuroplasticity would be a music conductor, for instance. When a conductor's on the stand and they're listening to a dozen different instruments, they're able to tune in on one specific group of instruments or a single instrument and focus on that and immediately jump to the next one when it becomes time to listen to the other. And those types of learned changes become natural. When we sit in our cars, for instance, when you first learn how to drive a car, you have to go and recite to yourself, I'm going to adjust my mirror, I'm going to adjust my seat, I'm going to adjust the steering wheel. But after years and years of driving, you do things second nature. You adjust your mirror, you didn't even realize you did it. I've been on drives, for instance, that are routine drives, and I forgot the entire drive because it became second nature. Why? Because I've wired my brain to accept that that's the way things are. Neuroplasticity occurs when virtual reality technology is used, but not just the technology itself. When used in combination with the behavioral clinical specialists, when used in combination with the ability to change social aspects, the thinking about pain, the time spent thinking about pain, things like that, when those things change regularly over the course of 3 months, they become lifelong changes that the patient becomes comfortable with. Again, as we've discovered over the years, pain is a multifactorial condition that is not just the actual injury that's caused pain, but your response to pain, how you deal with pain, how you deal with your family, your loved ones, and all those around you. If you make everyone around you miserable, there's a high probability you yourself are going to feel miserable because of it. So learning to change your behavior and attitude towards pain is a substantial improvement in overall control of pain. So the effect of neuroplasticity really depends on how much repetition, how much practice, and how much adoption the patient has. What we found is that a full course of 90 days that includes the VR therapy, the behavioral therapy, and the social changes can be lifelong and lasting. We just need to be able to get the patients to be compliant with the therapy. And that's where the use of the behavioral clinicians, the monitoring, and the encouragement that goes along with the use of the therapy becomes so valuable.
Harvard MedTech, the visionary solution to pain.